Hi there, and welcome back to this week's episode of the Delivered Podcast. I'm your host, Athena Estelle. And on this week's episode, I have been put in touch with one of the amazing physicians in the Jacksonville area. She specializes in the postpartum network. She is one of our great physicians, and she started a very cool postpartum just space. It's called the Motherhood Space. It's a very awesome new resource that we have. Her name is Dr. Jill, and we are just so glad that she's with us today. So welcome, Dr. Jill.
Yeah, thanks for having me.
Yes, absolutely. I know my friend Kayla, she was on the podcast prior. She is a great friend. She's also a doula. I know she kind of put us together. So I'm just really thankful that this worked out.
Yeah, it's been great to be in touch and be able to kind of share all these different resources with the moms and families out there.
Yeah, definitely. I think it's something that obviously, if you don't ask, you don't even realize exists. But then once you kind of start digging, we've gotten really fortunate in our area on your behalf and other programs that have started. There's, several resources at this point, which is great.
Yeah, it's interesting. When we look at the numbers, there are a lot of moms and dads who struggle with their mental health when they are pregnant and postpartum. And it reaches the millions in a year. And despite those numbers, it's interesting that in the United States, we still don't have all that many resources. But we are working on building more. So with all those a million people who are having struggles in a year in the United States, there are only about 30-day programs across the entire country for all these moms and dads who are struggling. So when you think about, millions of people and then 30 programs, it's quite discrepant.
That's crazy. I didn't realize it was that small.
Yeah. The state of Florida alone has 2 perinatal specific day programs. Perinatal just means the period of pregnancy and the postpartum period. And so in the state of Florida, with all of the people that we have living in this state, there are only 2. One of them is a virtual based program, and then the other is our program, the Motherhood Space, that is in person and has all these other cool perks to supporting moms and families.
That's awesome. So I know we talked a little bit pre-recording, but give the listeners just your medical background, how you started your medical practice, and just how it's led to where you are today.
Yeah, so I am a licensed psychologist with a certification and specialization in the perinatal period. And before becoming a mom, because I'm also a mom to 2 girls who are now 10 and 7, before becoming a mom, I was a psychologist as well, but I really didn't in this perinatal period. I had done a number of different other things. I had worked with veterans. I had worked with people with medical complexities. I had worked with kids in inpatient hospital settings. But when I had my own kids and went through pregnancy and postpartum, that's when I really started getting interested in this period. And so went and got more certification and more training, and ultimately have now specialized in this and worked to create a bunch of different resources for moms and families, a lot of which I wish I had when I was actually expecting or in the postpartum period.
I feel like that's another thing. They speak about the postpartum period. Obviously, you're discussing it, you have the baby, you're going through it. But then I think when you're on the other side, it's always, what I wish I would have known or had access to and things like that. So I think the fact that you've turned around and now created this space, I just think it's so cool. And it's obviously so necessary.
Well, thank you. And it's interesting because I also have a podcast. And so the podcast title is Hindsight is 2020, a Motherhood Feels podcast. And it's basically me interviewing moms and dads on what they wish they had known in hindsight. Because I think as parents, we often look back and say, man, if I had known this, or if only I had done that or had this resource. So kind of a different tact to tackling this time period and kind of having a proactive lens around it is some of the mission of the work I'm doing.
I think that's awesome. Now, let me ask you, in both of your pregnancies and then postpartum, did you experience symptoms with both pregnancies or just one of them? Or what was your postpartum journey like?
Yeah, so for me, when I was pregnant with my first daughter, obviously totally new and different, and I was in a new city. So I was here new in Jacksonville, and so didn't have a lot of local supports. And I would certainly say pregnancy was quite an adjustment. It came with a number of stressors with pregnancy, some potential medical complications that didn't play out, but that really got. And then the postpartum period was filled with a lot of anxious moments too. And so I think that was something, again, that if I could have done things differently, I probably would have had more support. I would have probably, people have probably heard me say this before, but I totally wish I had had a doula. I wish I had created a little village of support so that I wouldn't have felt as lonely. And, I think those are some of the things I wish I had had. With my second daughter, you still have anxious moments, but I've personally felt a little bit more comfortable in that pregnancy, having done it once before. But I think no matter if you're experiencing depression or anxiety or any other mental health symptoms, it's just a hard experience no matter, even if you're not experiencing any mental health challenges. It's just a tough period of time.
Yeah. And I think it's one of those things that when you're going through it, at least for me, I would always say like, oh, I'll never do this, or no, I won't do that. And then until you're living it and you're like, oh, I am doing what I said I would never do, or, oh, and so, yeah, I feel like people downplay the adjustment that you have to make mentally, physically, emotionally, all of it for your postpartum. Cause everybody just thinks, oh, you bring the baby home and you lose a couple hours of sleep and you just carry on. And it's like, yeah, it's not. Yeah.
So. And in fact, to get kind of technical, but I'll make it not that technical, there's this model that I talk about with a lot of people that I work with called the biopsychosocial model. And the idea behind it is that during this time period, when we're pregnant and postpartum, we have biological factors, psychological factors, and social factors that create this perfect storm that make us more susceptible to experiencing challenges emotionally or just with our adjustment. And so, we have hormone changes. We have, limited ability to cope because we don't have much time to do the things we did before to cope, like take the walk or do the hangouts with our friends. And then we've got tons of different social day-to-day vulnerabilities, like, hey, I'm not getting paid for my maternity leave, or I'm fighting more with my partner, or I have to go to 5,000 appointments to help keep this baby going. So all of these things come together to create this perfect storm to make it a tough time period. And I think it's not something that people pay much attention to, but there are lots of different vulnerabilities during this time period.
Oh, definitely. And even just seeing in the beginning, just seeing how like my husband had to adjust. I mean, I think that is rarely addressed. And even for single moms, whoever your support person is, like whoever you're leaning on, it's an adjustment for them because it's just so much change. Your whole world in a day is just, whoop,
It's true.
It's wild.
And I've done a lot of work with moms. And you mentioned the dad piece, so I'll just interject. I'm working this year on creating a space for dads. And so doing some pop-up workshops called the Fatherhood Space workshops. And they are going to be really neat. Our first one's this weekend, actually. And so it's just 1 hour, and it's 1 hour of dad-focused content. And people who register get a free drink. We're hosting them at a brewery, get a free book. And then the idea is that dads can get a little spotlight too, because like moms, dads go through their own adjustments that are similar but different. And so have some different ideas on how to help support them too.
That is so cool. I love that. I've never even heard of that. I think it's awesome.
Yeah, I don't know if there are other things that are like that out there. So this will be a bit of a pioneering effort, and it's going to take some groundbreaking guys to do it because, dads are not that often reaching out for support, but we actually know that at least 1 in 10 dads will suffer from perinatal mood or anxiety disorders themselves. And my sense is that statistic is actually probably a little bit of an underestimate. So 1 in 10
Mhm.
dads, but sometimes dads are not our best reporters on how they're doing. So again, I think that no matter if you're experiencing emotional struggles, the workshop is going to be designed for new, expectant, or even seasoned dads to walk through different strategies to just kind of move through parenting with a bit more ease and balance.
I love that. That's very cool. Now, so your kids were pre-COVID babies,
Yes.
correct? You said 10. Okay. So you were already in the postpartum space and treating during COVID, correct?
Yes, yes. I was upstairs in my bedroom seeing patients on my laptop with my kids downstairs doing homeschool and having their grandmother take care of them during the
Sure.
day.
Sure. Did you notice? I mean, I'm sure, and I don't know if you have a statistic, but this wasn't on our list of discussion topics, but I've always said that the risk and the, I don't know, eventual development of PPD, the perinatal mood disorder, I feel like that had to have been so much higher during COVID.
Yes, so it was certainly a really, really tough time for everyone. And then when you think about the perinatal space in particular, it meant that partners weren't able to go to appointments, or oftentimes doulas weren't able to go to hospitals for deliveries. So there were all these other
Mhm.
extra stressors that just add to risk of
Mhm.
experiencing emotional challenges. I will say, though, that this is an often overlooked piece, that there was a silver lining, and the
Mm.
silver lining was that insurance companies started to pay for telemedicine appointments. And so I, as a
Mm.
provider, had always wanted to be able to offer virtual appointments to moms in particular, because
Mhm.
moms, it's hard to get out the door and secure childcare. And those were barriers to getting moms in for support. And so, despite having to endure a horrible pandemic, the silver lining of that for the mental health space was that telemedicine now is supported. And so insurance companies will fund the ability for people to hop on your computer and have your baby in your lap, or have your toddler watching a show while you chat with
Mhm.
somebody like me.
That is so cool. And see, I didn't know that
Mm.
about that it wasn't approved prior. So that's a great silver
Yeah.
lining. That's very cool. Now, for those that have not heard of the motherhood space, tell us how that just came into existence. What was your mission with creating that? And then how has that gotten to where it is today?
Yeah. So after I had my first daughter, I went through pregnancy, and as a psychologist, kind of felt like, wow, we're really missing the boat here on capturing the emotional health of people. And so
Mhm.
a colleague of mine and I created a maternal mental health program for our hospital system. And we started with just offering outpatient appointments, so people could just have a individual therapy appointment with us. But then started kind of thinking, man, we could really make this even more comprehensive and better. And so I kind of brainstormed and created this 3-tier program, and that is what the Motherhood Space is today. And the first tier is giving talks and resources to people who interact with moms who are pregnant postpartum. So that means I go out and do things like this. I tell people about perinatal mood and anxiety disorders. I tell them how prevalent they are, that as many as 1 in 5 moms, and oftentimes 1 in 3 moms, and other groups of folks will experience a perinatal mood and anxiety disorder. And then tell them about the resources. So just getting the word out. The second tier is our YouTube channel. So we have a YouTube channel at the Motherhood Space, and it is a bunch of little short video vignettes where you see me talking at you with information on perinatal mood and anxiety disorders and supports and strategies for coping. And then the final tier is the day program that you spoke a bit about. And the day program is, I think, the neatest piece of it all. And it is group based therapy for moms who are pregnant and up to 2 years postpartum. And so moms come and have a quick initial appointment with myself or a colleague of mine. And if they're a good fit for the program, they join us for 3 hours a day, 3 days a week, for group based therapy. And we talk through strategies on healthy coping with things that are really common to most moms. And we
Mhm.
also have one of our 3 hours dedicated to wellness. So that means
Mm.
that people have a chance to do trauma informed yoga or walking therapy with us. And everybody who participates gets a guest pass to the Y for 30 days. We have a private lactation space. We have a massage chair. We gift all of our moms books that are specific to this period of time and resources on all of this stuff, and free childcare. So if you have children who are older, we have childcare on site, and babies are welcome in the group space. So it's a really cool program, and it's really helping a lot of people.
I think the whole thing is like, I mean, it's unheard of. It's unheard of. Like where I'm from, I've never heard of anything like this. Here, this has never existed. I mean, this is amazing. I thought of a couple really interesting questions that I hadn't thought of prior. So in the motherhood space, when they're coming, I think it's amazing that you did up to 2 years, because research shows you can have the symptoms up to a year, sometimes later. But I think even after that, I mean, I struggled until my daughter was almost 2.5. So I think the fact that you have extended past that, I think that's great. That's really cool. I mean, how did you decide, or not even decide, but I guess kind of, how did you kind of cap it at 2 years? Was there just like a research-based decision or just time?
Yeah, so we started with it being about 18 months postpartum. We've just shifted here and there. Honestly, it could go to 18 years postpartum. I think once you're a
Right.
mom, you're a mom. And so for space purposes, we went to 2 years. And it's certainly something that we have people say, I want to stick around forever. Or we have people who come in and support our moms who might have teenagers and say, we need one of these for teenage moms. So again, I think it could just kind of it could run forever for all ages and spaces in mom life.
I think that's so cool. Now, with the 3 hours, you said 3 hours, 3 days a week. Is it like, is it a set course? Like this 8 weeks is from the here to here, or is it like they can start at any time? It's just a rolling schedule, or how does that work for registration?
Yeah, that's a great question. So we have it where it is rolling admission. So we have some people who are starting their day one on a day when a person is ending on their day, which sounds kind of interesting when you think about it. But when you're in real time and witnessing, moms come in, and usually moms are a little bit skeptical and or nervous when they come in because it's a new experience and it's a little different. And then they're meeting moms who have been with us for 3 or so weeks and seeing them not only feel better, but feel comfortable, and who are oftentimes singing the praises of their experience. It certainly offers a lot of hope and optimism to that day one mom. So that's been a really cool piece of how the rolling admission works.
Or in 6 months or 3 months, or what does that look like?
Yeah, so everybody's journey is a little bit different and individualized, but for the most part, people come in, and the idea is we kind of give you this intensive program for several weeks or so. And if you feel like you could use some more support after the programming with us, we help you get connected with, say, an individual therapist, or some people might be working with somebody for help with some medication. We often are giving other resources like, hey, see if you get connected with Hope and Healing Jacks, where they do these trainings on attachment-based kind of parenting. So giving people some different resources and things like that. And then we're only a year-ish old ourselves. And so when we had our first Motherhood Space birthday, we did have people back for a birthday party, people who had participated in the program. And then when we come up with other ideas and resources, we always share them with people who have been with us as well.
Oh, that is so cool. I love that. Now, as far as outcomes, unlike your medical doctor brain, is there maybe not a questionnaire, or I'm not even sure what else there is, but as far as gauging progress, I guess, with your clients, is it more of like a one-on-one individual basis and just kind of seeing where they started with symptoms and where they are at a certain mark? Or do you have a baseline outcome measure that you're using to compare across the board?
Yeah. So the answer is both. We have everyone the first day they meet us for their intake appointment individually walk through not only just some history and just conversation about how they're doing, but also some screeners, so specific to pregnancy and postpartum, and how they're doing with symptoms like depression, anxiety, and adjustment. And then on their last day, we give them those same measures. And then when we finish up with them in the program, we send them information about where they were when they started and then where they were when they finished. The vast majority of people show symptom improvement. It's really wild. We really have people with us for, say, probably on average 3 weeks. So that's about 9 total days. And we presented at a conference recently, and 80 some percent of our moms showed some sort of symptom improvement in those 9 days. And if they didn't actually have symptom improvement per that measure, the vast, even more people would say they found value in the programming and they learned coping skills and strategies to manage the stuff. So that's really overwhelming success for just from a data point of view. And then qualitatively in talking to people, another thing that we do, so we're taking walks with our moms. We're doing walking therapy. During breaks, we're checking in with moms. And every day, moms will fill out just a short 1-page little rating scale of how they're doing, how they're sleeping, how they're eating, any stressors that are going on. So we will know that this mom and her partner had a big fight last night, or that this mom had the baby needed to go to the pediatrician because X, Y, and Z is going on. So we're able to just check in, kind of just see how things are going. And oftentimes that daily check-in that people are completing informs the work that we're going to do in group that day. So we pull from what's going on in real time to create the programming.
I love that. So it's not a set, like this day we're talking about this day. It's very situation based, a day-to-day basis.
Yeah. So I think some programs throughout, again, I mentioned there are not really that many in Florida, but some of the other ones that I'm familiar with have more of a structure where it's, okay, day one, we hit these topics. And we do have a general sense of what we want people to get and when, but we also really work to tailor it to what's going on in real time, because that's the current problem. Let's see if we can help with that.
Absolutely. Now, for their support person, either partner, spouse, mother, person that's with them on this journey, are they able to come with them to the motherhood space just as like a support person to come, or is it really just the mother and then the children if they're there?
Yeah, so that's a question we get from time to time. And we certainly have partners who might pop in and come and grab a baby to relieve a mom or to come and help with transportation and things like that. But the programming itself is really designed for moms. And interestingly, because we've had a number of moms say things like, what about the dads? That is the impetus for the Fatherhood Space workshop that I'm working on this year.
That's really cool. Now, you mentioned that as they're working their way through the program, you do have a couple other resources that you're able to point them towards at the end of getting close to their completion of the program. What are those other resources that you tend to gravitate towards?
Generally speaking, it's individual therapy and or medication management. But from time to time, people will want some resources around things like childcare or lactation support or other kind of community resources that we let people know about. We have a group space where we are doing all the group programming, and we've got a little board with everything tacked up with different people in the perinatal community. And so we usually have something or some resources that we can point people to with this community in Jacksonville.
Now, when you get like your fresh mom, say she's postpartum, a couple days, couple weeks, really in the trenches, what would you say are like your first, I don't want to say like tips, but your guidance in the very beginning? What are your keys to productive survival at that point, pretty much?
I like that phrase, productive survival.
I just thought of that.
It's very good. You need to trademark it. What are our first tips? I think one of the first things that my colleague and I work to do is to help take care of the moms. And so moms are really good at taking care of their babies and their children. And I think sometimes when they come into our space, it feels very funny for them to have somebody say, hey, can you fill up your water bottle? Or we've got some snacks over here. Why don't you grab something? Or you don't feel like walking today. Why don't you sit in the massage chair and we'll bring you like a coloring book or something? And I think that piece, like mothering the mother, is a really nice sentiment to have as people are coming into the program. From a skills-based perspective, I think one of the things that we really work to have moms internalize is that you're not alone. And that's
Mm,
probably the overarching sentiment that we get from moms after or even during the time in the program is, I was sitting at home and just feeling like I was the only one. And then I
mm,
got here and I can see that despite all the differences that we have, we share this time and this challenge, and it's the kind of overarching commonality. And so
mhm,
that is certainly normalizing. And then we also just work on some basic self care skills. And I say basic because they sound really simplistic. But as a mom, I'm sure you recognize that they are so much harder to tackle in motherhood. So we work
mhm.
to help people really be able to personalize their self care despite having kind of a time period where it's really hard to do just that.
Mhm. It's funny. I've said this before. I feel like people that listen consistently are probably sick of hearing me say it, but I don't think I ever truly understood what self-care is until I became a mom. Because I think pre-kids, you just like go about your life. If you're busy and productive, like how I am most of the time, you just do it when you can. You don't really think about it. At least for me, I never did. And then you have a child and it's like, I don't think I ate anything today. And did I drink water? And like all just like basic needs.
Yeah.
And it's crazy because psychologically, you're not thinking these are your survival needs. You're just thinking, I need to keep the baby's diaper dry and keep them fed, so we just go straight to the back.
Mhm.
So it's funny that you said that because that is just, it's very simplistic, but I think 90% of new moms would agree it just goes out the window. You just literally forget that you exist.
Yeah. Yeah, it's
Yeah.
true. And we have an acronym that we work through with moms, and you might have heard of it before, but I'll share it if you're interested. It is this nurse acronym. And so a good nurse is going to take care of you. The idea behind the nurse acronym is that you can use these skills to take care of yourself. And the N stands for nutrition and needs. So, whatever your needs might be. And it's always interesting because when we bring up nutrition, I can guarantee that moms are going to say, "Oh, I know when my baby was last fed or how many ounces my baby had." But they are like, "I don't remember when I ate." So, that piece
Yes.
is really overlooked. U stands for understanding. So, an understanding of your own health. The R stands for rest or relaxation. Again, kind of a comical expectation during this time period, but it's one of the reasons we have a massage chair. Might not be
Mm-hmm.
sleeping, but can you just sit down and close your eyes for a minute and kind of zone out? The S stands for support. So utilizing the supports around you to have some relief and do some of these different skills. And then the E stands for exercise or purposeful movement, which is again part of the wellness piece that we do. So the walking
Mm-hmm.
therapy or the trauma informed yoga, just stretching. So those are all things that are helpful and help our emotional health and just kind of help moms feel better.
Yeah, I love that. And, I'm a transplant. We're from up north. So I think this program could be really helpful for people that don't have an established village or maybe just their partner, but their partner is going back to work and, all of those things. I think this is such a nice option for people who really just don't have anyone else to, immediately call or to look to. And I think the fact of it's like that bonding experience when you feel other moms going through it simultaneously, just knowing that you're not on an island. Because I think the first time you become a mom, at least for me, it felt like very isolating. I mean, COVID didn't help, but even despite COVID, you're still isolated in your house with the newborn. Your life has just dramatically changed. So I think the space that you've created really, I mean, it's a tiny village.
Yeah. And again, going back, I think our situations mirror each in that I also am a transplant, I was coming from New York, and I was like stalking friends. I've got to find a mom friend. And I,
Yes.
in fact, did stalk some friends and found some and have a nice village now. But that's the piece that was really missing for
Hmm.
me. And so, again, one of the things that I really tout, and I haven't mentioned, but will, the motherhood space is a great resource. And I also created another resource that is designed to help people, again, proactively cope. So I have a before baby boot camp, and it is an
Mm.
online course, and it has a handbook that goes with it. And it's really all the things that we don't pay attention to ahead of having a baby. So I don't know
Mhm.
about you, but I had a baby registry, I had a baby shower, but I really didn't, despite being somebody who works in this field, prepare for the emotional piece of it. And so
Mm-mm.
this boot camp kind of helps people get their head wrapped around things they can do to proactively reduce their risk of experiencing emotional health challenges and be a little bit, again, more proactive. So that's kind of all part of this whole mission in the work I'm doing.
I love that. Yeah, I'll grab the link for that so we can post it in the notes because that's awesome. I've always said, now that I've gone through it, obviously my daughter is 4.5 now, but I feel like if I were to get pregnant again, I would have a therapy appointment set for 2 weeks postpartum. Like the minute I had that baby, I would call and be like, I need to see you in 2 weeks. And even if you're fine and good and dandy, I still think just having it set in case,
Yeah.
I mean, I would have been in a completely different place. I can say that.
Yeah,
So, yeah.
100%. Yeah, the one of the things in the course is just a one pager with all of the ways you can put all the people in your village down to help you be thinking like who's the
Mm.
lactation consultant going to be? Who's the doula? Who's the person who's going to be able to help me with meals? Who's going to walk my pets? Who's going to hang out with my older kid? Stuff that you can plan around to help life be a little easier.
Hmm. Yeah, that's a great tip. I love that. Yeah, that sounds great. I'll definitely share that. That's
Yeah.
awesome. Now, is there anything that I haven't asked that you think is good to share either about the motherhood space or what you're seeing right now with your clients or really just anything? You've been a wealth of knowledge.
Well, thanks. I think a couple things I haven't talked about and can share. So, some of the unique ways that I'm trying to get information to more moms and families is with some books I've written and some movies and little short films I'm making. And then some ideas I have around getting this stuff embedded into corporations. And so I've written two short rhyming storybooks. One is called Motherhood Feels, M is for mom, and the other one is called Fatherhood Feels, D is for dad. And they are short and rhyming. And so I did that because no one has time to read a long novel. And rhyming feels nice to read, and the cadence can be easy to read to a baby because a lot of times moms and dads are reading to their kids, but not themselves. And it
Hmm.
has healthy mental health kind of information embedded in the book. So I think those can be really cool baby shower gifts. And really what I'd hope is that different healthcare systems and or corporations can gift them to their moms and dads so that this whole area of maternal and paternal mental health can be given a bit more spotlight. So that's
Hmm.
one area that I'm working on. Also, trying to get some of the word out through filmmaking. And I
Hmm.
created a short film called D is for Dad, a kid's view. And it's a short little documentary from my kids' point of view on what dad life is like. And it's going to be a little film festival later this year.
That's
Yeah,
awesome.
it's kind of a fun adventure. I've never done anything like it. And so it's actually inspired me. And I have started work on a film with previous patients of the motherhood space. And so I have a handful of moms who've gone through the motherhood space, and I'm going to work on creating a little documentary of the same.
That is so cool. I think that's awesome. Now, will the film fest that you mentioned that the mini doc will be on, will that be local here?
No, it's actually out of Philadelphia. And so I
Okay.
have submitted it to this film festival. It's on YouTube right now. It's 5 minutes. It's just real short, but it's fun. And it gave me some inspiration and opportunity to learn a little on filmmaking. And so I've got a trailer put together for this film I'm doing on the motherhood space and patients who've gone through it now, too. So kind of just a different way to get information out there.
Yeah. Oh, definitely. And I mean, people are looking, people are searching for this information. And I think it's great that you're using different channels to get it out there.
I think one of the things that I'm learning is that, particularly with dads, but with moms as well, it's harder to reach people when you don't make things accessible. And so we
Mm.
know that the vast majority of people and parents are working and employed for paid work. And so
Mhm.
part of what I'm thinking makes a lot of sense is to meet people in their businesses or in healthcare where moms often go for appointments when they're pregnant and postpartum so they can get this information. So let's not make it harder. Let's just make it a little easier. So that's kind of some of my thinking on that too.
I love that. That was such good information. I'm so glad that you're doing that. That's very, very interesting. I think that's great.
Thank you.
Now, let me ask you the registration on the motherhood space. I will have it linked on the link, but I'm assuming they can just go straight to the website. The mom can just register herself, say if she does have to bring a child, things like that. Is that how you would recommend for them to get involved?
Yeah, so for the motherhood space, you can call the number 904-376-3800, option 4, and you would
Okay.
speak with one of our new patient coordinators, and they would do a few things like see what insurance you have, see if you meet the criteria for scholarship dollars, because we do have that for moms who utilize Medicaid, and then help you kind of get situated with a first appointment. And the first appointment is a virtual appointment. And that's just a one on one appointment just to see if you're a good fit for the program, make sure we're getting you connected to the right resources.
Okay. Let me ask one question about that. If a mom, let's say she doesn't have insurance or she has come off insurance, something like that, is there a cash rate that the patient can pay or how does that work for them?
Yeah, so self pay is probably pretty pricey. So,
Okay.
for the vast majority of people, they are moving through insurance, which tends to cover it.
Okay.
And again, we do have scholarships for moms who utilize Medicaid.
Oh, okay. That's great. That's great. Now, I always ask at the end of every episode, it's like my favorite part. I don't know why, but I always ask, so for you, just seeing your postpartum growth, creating this space, literal space in a building, but also like mentally, emotionally, just creating this whole space. I don't know, like that didn't exist. If you had to sum all that up in one word of how that has touched you personally or how you've been affected by it. If you had to pick like one word or a phrase, what would you choose?
I suppose maybe heartening. It just feels really nice and rewarding. Maybe that's the better word, rewarding.
Mhm.
I am really fortunate because some people have paid work that is a grind and they dread, and I do not have that. So I have a
Mm,
colleague that I really like working with. I have moms and dads and families who are really cool. And it's like going to get to hang out with your friends and just help them feel different and better.
mhm.
And then get feedback that more often than not, they are just that getting better. And so rewarding, I think, would be the best word to sum that all up.
That is so cool. I mean, honestly, you're changing lives in a different realm, but I think that's what you're doing. I think it's amazing.
Well, thanks.
Yeah. So I will link the motherhood space and then I'm going to link the books that you mentioned and the few other things we talked about. But I'm so thankful for your time. I'm so thankful to Kayla. Shout out to Kayla. Really appreciate her. But this has been great. And I just appreciate what you're doing for our city and for our moms. And I'm just really grateful for your time.
Well, right back at you. Thank you for having me.
Yeah, absolutely. Thanks for listening. We'll see you next week.